Hey everyone, and welcome to our deep dive today. We're going to be focusing on something
Oh, yeah.
that is particularly important for older adults
Okay.
and their caregivers,
Mm-hmm.
and that is preventing blood clots,
Right.
and then also understanding how to safely use blood thinners.
Yeah.
We've got a couple of really interesting medical guides that we're going to be pulling from to kind of help us unpack all of this.
Yeah.
And believe me, there's a lot more to know than you might think.
That's true. It's a topic that I think people often oversimplify a little bit. They're like, oh, blood clots, that's just a worry for long flights.
Right.
But
Yeah.
so much more than that,
Yeah.
particularly as we age.
Okay, so let's break it down. When we talk about blood clots, what we're really talking about
Yeah.
is deep vein thrombosis, or DVT,
Yeah.
right?
Mm-hmm.
These are the clots that typically form in the legs.
That's right. Most often
Yeah.
in the legs. And, these guides really emphasize the danger of these clots
Okay.
breaking loose and traveling to the lungs.
Oh, wow.
And so that's a pulmonary embolism, which is basically a blockage of
Right.
blood flow to the lungs. And it can be very serious very quickly.
Yeah, that's really scary. I know when I was reading through these guides, one of the things that surprised me was just like how many different risk factors there are
Yeah.
for blood clots. And some of them I don't think people would expect.
Right.
What were some of the things that kind of jumped out at you?
Well, we know age is a big one,
Right.
especially after 65.
Right.
But one thing that these guides highlighted was the link between certain medical conditions
Okay.
and an increased risk of clotting. So, for example, cancer, heart problems, even something like varicose veins
Oh, wow.
can increase your risk.
It's like a domino effect almost, right?
Yeah.
Like one health issue
Mhm.
can got to trigger another one.
Absolutely.
And then on top of that, you've got things like medications,
Mhm.
hormones like those in birth control pills,
Mhm.
even lifestyle factors like obesity
Right.
and a high-salt diet.
Yep.
It's kind of like a perfect storm.
It is. It's a very complex interplay of factors, and that's why it's so important for older adults
Yeah.
and their caregivers to be aware of their own individual risk profile. Talk to their doctor. Be proactive.
You know, it's funny you mentioned that because I was recently talking with a friend of mine who had a blood clot after
Oh,
surgery.
wow.
She's in her late 70s. And, she was aware of like the general risks,
Yeah.
but didn't realize that like her recent hip replacement surgery had really increased her chances.
Wow.
And it was a real wake-up call for her. And it made me realize, like, we really need to be more informed about this stuff.
Absolutely. Knowledge is power.
Yeah.
Especially when it comes to our health. And the good news is that even small changes in our habits can make a big difference in reducing our risk.
Experts. So, knowing the risks is really important.
Yeah.
But what I thought was so interesting in reading through these guides
Mhm.
was just like how much emphasis there is on prevention. There are things that we can do, especially as we get older,
Mhm.
to help keep our blood flowing smoothly.
Yeah, absolutely. And, one of the simplest yet most effective strategies is staying active.
Oh.
It doesn't have to be anything strenuous. These guides specifically mention short walks, even just moving your legs while you're sitting down.
And that's so important, especially
Yeah.
for older adults who might be
Right.
less mobile or spending more time at home. One of the guides actually suggested
Yeah.
some easy exercises you can do just sitting in a chair,
Oh, cool.
like ankle pumps or knee lifts.
I like it.
I've started doing those while I'm watching TV,
Mm-hmm.
and it's amazing how much better my legs feel.
That's great. I love that you're incorporating these tips into your everyday life.
Yeah.
That's what it's all about.
Right.
And speaking of simple things, the guides also emphasize the importance of elevating your legs
Right.
whenever possible.
Okay.
It helps to reduce swelling and improve circulation.
I've started propping my legs up on a pillow while I read at night, and it's actually become like part of my relaxing routine. It's
Mhm.
amazing how something so simple can make a difference.
Totally. And for people who might be more at risk, compression stockings can be a real game changer.
Okay. How do those work?
So they gently squeeze the legs,
Okay.
which helps to push blood back up towards the heart.
Now, the guides mention that it's really important to get the right size and fit
Hmm.
for those stockings, though, right?
Oh, yeah, absolutely. You want to make sure that they're snug but not too tight. And your doctor or a pharmacist can help you with that.
Okay, that makes sense.
And then, of course, staying hydrated and watching your salt intake are also important for
Yeah.
overall health, including healthy blood flow.
Those are good reminders for all of us, no matter what our age is.
Hmm.
But let's shift gears a little bit and talk about blood thinners,
Okay.
or anticoagulants, as they're sometimes called.
Mhm.
These are medications that are often prescribed to treat and prevent clots.
Right.
But navigating them can feel a bit overwhelming.
Yeah. I understand. There's a lot to consider, but
Yeah.
these guides do a really good job of kind of demystifying blood thinners. They break down the different types,
Yeah.
how they work, what to watch out for.
One thing that really stood out to me was the difference between heparin, which is typically given as an injection, and then warfarin, which is a pill.
Yeah.
So why those different approaches?
Well, that's a great question. The guides explain that heparin is often used initially because it acts very quickly.
Okay.
So it's crucial in situations where there's already a clot that's formed that needs to be addressed rapidly.
Got it.
And then the treatment plan will often transition to warfarin,
Okay.
which is taken orally.
Yeah.
And provides that kind of long-term prevention.
So it's like a 1-2 punch,
Yeah.
right?
Yeah.
You're tackling the immediate problem
Yeah.
and then also providing that ongoing protection. But the guides also really emphasize the importance of safety when taking blood thinners.
Right.
It seems like there's this delicate balance between preventing those clots and then managing the risk of bleeding.
You hit the nail on the head. Blood thinners are powerful medications, and they do come with risks.
Okay.
And so one of the most important things that these guides stressed was taking your medication exactly as prescribed.
Yeah.
So no skipping doses, no doubling up. Timing is key.
Yeah. It's so easy to forget a dose
Yeah,
or get confused when you're taking multiple medications,
absolutely.
especially as we get older. I know some people use pill organizers or reminder apps to kind of help them stay on track.
Those are great strategies. And equally important is open communication with all of your healthcare providers.
Okay.
So your doctor, your dentist, your pharmacist, let them know about every medication, vitamin or supplement you're taking, because it's all interconnected.
Yeah, it's like having this team working together for your safety.
Right.
And you're the captain of that team.
Exactly.
It's about being proactive and being your own advocate. I know it can feel a little daunting,
Yeah.
thinking about all these potential risks and precautions, but, the guides were really clear about one thing. Life doesn't have to be on hold
Yeah.
just because you're taking blood thinners.
Absolutely. That's a really important message, especially for older adults
Yeah.
who may already be facing
Yeah.
limitations or changes in their lifestyle. And, these guides actually had some great advice on finding that balance between staying active and staying safe.
So what does that look like in practice? I mean, how do we know which activities are safe and which ones might be too risky?
Well, the guides emphasized the importance of open communication with your doctor. They can help you assess your individual risk factors and come up with a personalized plan. So, for example, walking, swimming, cycling are often good choices for people on blood thinners because they promote circulation without a high risk of injury.
I see.
Contact sports or activities with a higher chance of falls, on the other hand, might need to be modified or avoided.
So it's about being mindful, right?
Yeah.
Not letting fear dictate your life.
Yeah.
But making informed choices
Yeah.
that align with your health goals.
Exactly. And one of the simplest yet most effective strategies for staying safe is fall prevention.
Yeah.
The guides had some really practical tips on this.
Like what?
Things like wearing non-skid footwear,
Yeah.
removing tripping hazards around the home, making sure that rooms are well lit.
It's like creating a safe haven for yourself, removing those potential dangers. And it made me think, wouldn't it be helpful if, everyone knew about the increased bleeding risk associated with blood thinners? What if there was a way to kind of signal that to others, especially in case of an emergency?
You're absolutely right. And the guides actually mentioned that.
Yeah.
They recommended wearing a medical alert bracelet that clearly states that you're on blood thinners. That way, first responders have that crucial information right away, which could be life-saving.
It's peace of mind.
Yeah.
For both you and your loved ones. It's like having that extra layer of protection.
Yeah.
Just in case.
Absolutely.
It's amazing how much valuable information we've uncovered from these guides.
I know. It's really interesting stuff.
It really underscores the fact that knowledge is power, especially when it comes to our health.
Right. And it's not just about knowing the information. It's about applying it to our lives, making those small but impactful changes.
Yeah.
So as you think about everything we've talked about today, I want to leave you with this. What's one action that you can take this week, no matter how small, to reduce your risk of blood clots or to ensure the safe use of blood thinners? It could be something as simple as scheduling that checkup with your doctor, clearing a clutter-free path in your home, or starting a new walking routine.
That's a great question to ponder. And as always, thank you for joining us on this deep dive. We encourage you to keep exploring this topic, talk to your healthcare providers, and remember, even small steps can make a big difference in safeguarding your health and well-being.